Hello and welcome to my campaign on promoting healthy relationship communication in first-year students. I am Sophia Iacobelli. To begin, we're going to talk about the health issue that I chose. I chose unclear communication and weak boundary setting skills among new college students. These skills are rarely taught but immediately required once students arrive on the campus. As much as poor communication isn't just a social issue, it also affects the stress levels, the daily functioning, academic focus, and emotional health. With this health issue, some of the short-term and long-term effects are going to be discussed, such as with the short term, students may feel overwhelmed or unsure about how to navigate relationships. With long term, these patterns can follow them sometimes for years, shaping future friendships, dating experiences, and even workplace relationships. These students that I decided to choose were the first year college students, and I decided to choose them because I feel like they experience many new pressures all at once. New friendships, living environments, social experiments, and independence. So they fit the perfect issue for the communication because I feel like it plays a really big role in their adjustment. Theory and research, the social cognitive theory. So the social cognitive theory focuses on the modeling directly shaped by both of these messages. Instead of saying communicate clearly, I show students what clarity looks like. The theory of planned behavior. For this, I decided to show the communication the choice to communicate in the first place through the message where she kind of reached out and said, "Hey, can we talk about this?" I feel like that shows in the theory of planned behavior. If something might feel normal or doable, then I feel like they're more likely to try it, especially by seeing it. So in my supporting research articles, I decided to choose these two. I felt like these studies really supported my campaign. They showed that communication quality directly affects emotional health, and they also justify using short, simple, behavior modeled messages. My campaign overview. The goal is to not just lecture students. It's really just to show them that communication is part of the everyday campus life and that it is normal and that it is okay. I don't want them to feel awkward asking questions or expressing those boundaries. The first message that I chose to do was the bulletin PSA. I feel like this PSA really aligns with my health issue because it acknowledges the feelings are a core part of healthy communication. I also think that having the statistics and easy to read layout really helps. Also, I feel like it captures your attention with all the red, and then it destigmatizes the emotional struggles that, college students may be dealing with. The second message that I decided to do, it was a reel, but I did end up changing it for the format of this assignment. Um, but why I feel like this works is because it shows a real student conversation. I feel like it shows a real natural way of setting those boundaries. And then I also think that by using text message, which is something that I feel a lot of students turn to when they're not comfortable saying things out loud, was a really good way to show this and show them how they can do it. Um, but I do think that this message is usually going to be perceived as entirely modeled behavior. I feel like it gives the students the words that many might not know how to say. And I think that the I just want to be clear about what I'm okay with before we hang out was a perfect example of something they may want to use in the future. How these messages work together. I think that students see the same values repeated online and on campus, which will just continue to reinforce those norms. I mean, they're going to see the bulletin and then they're going to see when they're scrolling, and I think that it will continue to reinforce this. In conclusion, I think that healthy communication is a real health issue. First year students are going to need the support as they adjust. And I think that this theory can help shape effective health messaging. And I also think that it gives a proper guideline for what that might look like to send that message to maybe first year college students. Together, I think that they normalize the emotional honesty And I also think that this will reinforce some of the norms that we want to reinforce. In conclusion, this campaign both supports the emotional health and relational health, which helps students feel safer, more confident, and more connected during their first year. Thank you.